Bonjour.
Hello,
Hello, Dr.
hello,
Hello,
hello. It's a pleasure to be here with you today.
It's a pleasure for us also, for the second time.
third time.
Yes,
Third.
so, yes. I have to learn your amazing language because I was missing so many interesting concepts listening to the previous speakers. So I have this mission now to learn also your language.
We will help you.
I will ask for support.
We will help you, but you will have to
Yes, teach us
the
Italian.
Italian. Yes.
Perfect, agree.
So we will be with Dr. Fabio Sinibaldi, psychotherapist, founder of Association for Integrative Sciences. Okay, so we are ready if you are ready, Dr. Fabio.
Yes, I will share my keynote.
Okay.
Okay,
We will
perfect.
talk today about the need for an integrated approach, cases studies, practical indications. Yes. So
Perfect. Thank you again.
Thank you.
I want to be very practical today, so I will do a very small introduction, and then we will see two practical cases and work on them to discover why we need an integrated and an integrative approach to do our job at our best. For sure, today complexity is an issue. From everyday life to the pathological cases, we see everything interconnected. If someone, a patient, tells us, I've got a problem, whether he's talking about a personal conflict, anxiety, or a chronic pain, what are the causes behind this problem? And then which are the levels we have to work on to help them at our best? To give some examples, today life is characterized by extremes, very high, very low. It's difficult to stay in a healthy middle. In fact, we are always seeking for a high intensity at work, in relationships, even in our spare time. If we are at the restaurant or during the holidays, we are always chasing intense experiences. It's difficult to be satisfied with something normal. We want extreme, high, very powerful sensations, but it's hard and it's not healthy. Even if we can reach this kind of levels, it's not healthy. It's not healthy in the long run. In fact, the vast majority of people today lives in very hard conditions. Sleep deprivation. Recent studies tells us that 95% of adolescents and adults are living every day in sleep deprivation. We don't sleep enough. The majority of the adults have exaggerated workload and often overload, and there is no recovery time or not enough to balance the situation. And it is very bad for our mind, for our brain, and all the nervous system. So even if the problem is mental, is cognitive, I have to be concentrated at work, I have to avoid errors at any cost, the load to the body is very huge. And so on. We also we are often required to offer top performances. And it's nice because we are always improving ourselves, but it's not good. Also, our passions are going into the direction of being craving oriented. In fact, it's normal to watch television series in binge watching modalities. We are addicted to the social networks. So it's a very complex scenario. And to give a first concrete example, try to imagine what is this picture about. We don't have, sadly, the time to play and see your hypothesis, but these are the causes related to obesity in childhood. There is everything: social psychology, individual psychology, of course. So I have my mental schemes moving me towards being obese, but what my parents, my peers are thinking, the behaviors is strongly influencing me. But there is also the individual physical activities, the physical activity of the environment I live in, the food production. It seems obvious, but it is not. The fact that I can find on the shelves in the supermarket some food or others can influence what I'm going to eat. And the food consumption, my habits, the same foods in different times of the day can have very different implications in the way I think, in the healthy performance of my body, on everything. We will discuss this more in depth later. And so individual physiology, if I am hyperactivated by a trauma, physical or emotional or both, I can, and my microbiome, my intestinal microbiome is altered. I can eat vegetables all day long, and my bad microbes in the gut will transform the vegetable fibers in sugars and then in fat. So I can have the best nutrition, but if the system is not working well, it's a problem, and I pay a price also for good habits. So going back, I have to work on the individual psychology, on the buying behavior, but also on the physical activation, so on the overall activation due to a trauma or something else, chronic stress, and not well-regulated emotions. I have to work on all these aspects to regulate both the mind and the body, and so all these lines can be turned into virtuous influence. So I can have a good changes all over the body and the mind. This is a complexity hard to manage, so we can use more structured schemas in which we can put all these levels of complexity. This schema is good to see top down, bottom up, all the levels. So if we have a behavior, it can be the result of all these. On genetic level, we can do very few things, but we can do something to respect the data inside our cells that is not modifiable. But we know today epigenetic is a huge area. We can do a lot of interesting things. In fact, epigenetics is the way genetic is expressed. And about how much we are told, there is not a lot we can do on epigenetic. But about anxiety, depression, pain perception, we can do a lot. The cell is very important. We can work on the metabolism. So our body has all the energies to produce everything. Today, rising field of study is called metabolic psychiatry. It's the way we think, our emotions, the way our emotions take shapes, is really influenced by the way our brain, our nervous systems in general, uses the energy we have from oxygen and from food. So we have to work on that. And it's true, the different direction, if we have a better way of seeing, we change mindset, if we regulate our emotions, if we give the right space to our needs, to our social schemas, we can regulate the structures and go down inside the cell. So everything is really connected. The sciences, I am the founder of the Integrative Sciences, the association that studies all the sciences, because all these sciences are connected. If we want to take a giant leap and empower the way we work, we can consider everything. So we can be psychotherapists specialized in emotions, but we have to include at least the body, the movement, the biomechanics. We will see something really interesting about biomechanics and anxiety. And of course, we can work on genetic and epigenetics, on neural plasticity, on the environment where we live in, and so on. So let's take a look at two practical cases. My first question is a sort of a provocation. And my question is this a case for a psychologist or a psychotherapist? Or is a case just for a physiotherapist, a osteopath, a trainer at the gym? Probably, given the premises I've put, you can understand it's a case that can be managed by all of them. And we, as a psychologist and psychotherapist, can start to work on the body as well on many, many levels. So we can start taking a look at his posture from a mechanical point of view, but going back to the emotions. In fact, this line, the central line, is the line where, if we have a good postures, the hips, the shoulder, and the ear should be. We have not to be perfectly aligned if we are not so young, good, and in good shape, but we have to tend to go into this direction. I give you a spoiler to give you the ability to see what I'm talking about. Okay, this is the same boy after 3-4 months working with an integrative approach with me, changing almost nothing in the sport, in the training, in the physiotherapist or osteopathic sessions. Okay, you can see also the elbow, the hips, the shoulder are perfectly aligned. The ear, this is normal, it's more close to this line, and we have the mouth that naturally change from open to naturally closed. So we have to go back at the beginning of the treatment and see what we can analyze from our point of view. Okay, we can see at least see three areas. If we look at this curve, we we can know that this is caused by a contracted diaphragm due to chronic anxiety, trauma, or stress. So it's our field. And we work, and we can work in many ways on this, even without touching the patients. The implication of this curve is that the head is forward, the head is very heavy. And so this causes an imbalance, a frontal imbalances. And this has a biofeedback, very strong biofeedback about safety and emotional stability. So we have a liaison, we have a linkage between symbolical stability, emotional stability, and real physical stability. Another implication is the shortness of breath. If we have this situation and also this one, we can keep shorter breath, also because we are closed, and so the lungs can't expand as well. And this is, and again, a biofeedback very bad for our anxiety feelings or emotional regulation in general. Even more, we can watch this position from a social, ethological perspective and say this is the typical posture of submission in all the mammals. In fact, I don't know in your language, but in English and in Italian, you say to someone, if you want to submit it, to knee and to bend the head forward. You can think about it also in the old courtyard, the reverence, the submission in religion as well as in kingdoms is made by this gesture because it's innate. Dogs, horses don't know these social rules, but do the same gesture. Okay, I see a chat. I will look if it is a message for me. Okay. So what we can do, I don't know if the message in the chat was a surprise or was a provocation. Of course, I'm not the first one saying this correlation. What I want, where I want to bring you is to some complexity that maybe you know, maybe someone doesn't know. One of these implication is this one, that the diaphragm is nested and arrives till lumbar vertebra in the lower part of our back. So if we work on the diaphragm here, we can change this curve, and also we will see this curve. Another aspect very important about the diaphragm is to know all the movement. The diaphragm is here in orange. So when you inspire, the contraction lower it to expand, to gain more height in the lungs. The ribs and the sternum elevate, so it is normal to expand a little. And in many breathing practice, in yoga practice, there is the so-called belly balloon metaphor. And it is important to know that you have to inflate all the air here, expand the lung in both directions, and naturally the belly, all the organs, digestive organs, will go forward, but this muscle have to be not contracted. The great risk of the balloon metaphor is this, that a lot of people, after explaining this metaphor, will expand the rectus abdominis. And so the belly seems to inflate, but it's not moving the diaphragm. It's just the rectus abdominis going forward. So it is important to taste the belly and feel that it's very tender, that this muscle is not contracted. On the opposite, going back to this message. Okay, where is it? This. On the opposite, in expiration, you have a reduction in shortness in both directions of the lungs. The thoracic cavity reduces. And now, if you contract the rectus abdominis, you can even more release the diaphragm and gain a huge advantage and go back to physiology. So you can see a lot of details are at play in this game. In fact, with this boy, we worked on all these activities. One of them is the vagal reset. It is a breathing techniques where exactly you extend only the diaphragm in inspiration, relaxed with the arms open that way to release all the back muscles. And then you have this inspiration where you release all muscles and contract just the diaphragm this way. The second phase is when you release as a rubber band, the diaphragm goes back. And a third phase where you contract the rectus abdominis and totally empty your cavity and gain a total reset of the respiration cycles and of the vagal activity. And here you can have a huge change in postures, of course, but also in stress levels, not at the cognitive level. In the second case, we will see, I use that last slide now just to help you see what I'm thinking about. We measure HRV, heart rate variability, and the cortical activity and subcortical activity of the brain, and you gain also an enhancement on that level. So it is really important to consider what you can achieve paying attention to all these details. Another important aspect we can analyze, looking at this guy, is that we have the antero-forward rotation of the shoulder. This is the request. The initial request of this guy is exactly this. I'm frustrated. I can't help. I've done everything, but my shoulders are always forward. And if you go to a standard physiotherapist, the normal answer is you have to gain more muscular mass on the back so you can open your chest. But of course, it's clear that this guy has enough muscular tone and mass. So what we can think about from an integrated perspective, the shoulder forward rotation is due to the activation of anger, aggression muscles. To understand this concept, you have to consider that our brain, normally when we are relaxed, is in the default mode network. It's common to all mammals, and I think cats can very well represent this kind of being. So if we are in this mood, we can think, we can enjoy things. If there is a problem, an hypothetical problem, a threat, accused of a threat, we can activate another brain system and work on this threat. And if the threat is confirmed, if we can't solve it very quickly, we have to move to the central executive networks. All these networks are related to different muscular chains. So there is this interesting connection from which part of the body we move and the brain networks that are active right now. Once again, I'm not the first one looking into this direction. My point is that in the past, a lot of theories that is good has looked at this correlation from a more symbolical perspective. The heaviness we have on our shoulders. If we are stabbed in the back, we contract some muscles, and it's good. I want to share with you the perspective on neurobiology and muscular chains that is in part confirming that theories, in part goes in a different ways. And these ways, for example, talk about this shoulder, where aggression gives this rotation forward. It is ectologically explained because, consider this, if we are facing someone very aggressive, we naturally do this movement. So we close the jugular, we protect the viscera, and we expose, by contrary, strong muscles and big bones. So it's a protective muscle. And more, it is a problem for this guy, and it is a very good correlation between symbolical and biomechanical levels. Think of a cat. When he's threatened and is scared, it does this. It's to seem bigger. So we have also this tendency to protect and look bigger. So there is a conflict in this boy saying, okay, I want to be bigger from a ethological perspective, but I don't like this position because it's also a submission position. So we worked with this position. This position, this muscular chain are very well studied. For example, this is the defensive activation that is on a spiral dynamic function. We tend to rotate on ourselves. In fact, you see many very insecure, shame people that are also tending to rotate. And by contrary, the default mode network, the relaxation, is about using frontal and stabilization muscles. These muscles are very sensible to a couple of mechanisms. These mechanisms are that we can regain the natural position and release this contraction if we use the alternance between pushing while exhaling for 7-8 seconds, then release, put the muscle back while inhaling, then again, 3 or 4 cycles of this movement. just from a muscular biomechanical point of view, you have the release of the so-called Golgi corpuscles that are the particles where there is the muscular memory. So even if there is no mind, no emotions, no symbolisms, you gain a more open posture. Then, after some sessions, to take also confidence with this kind of movement, to learn to do by yourself, because these guys worked with me once a week, but each day has to do this work against the border, the frame of a door, moving forward. So he has to manage correctly this procedure. After a week, when it was quite good during the procedures, then we activate the right mental imagery while doing this. And so protecting, but not with fear, with mastery, with self-control and release. And so in physiology of breathing, of movement, we are switching between these salience and default networks, giving back the possibility to the nervous systems to unlearn the traumatic or the defensive posture. Okay. And this is the first case I wanted to talk about. I want to talk about another case. This girl, what differences can you see? It's about emotions. Can you identify a correct emotion for each one of these pictures? Or at least, where is the picture where she feels good, better, and the worst? And try to expand our analysis. Think about broader categories, such as this expression, facial expression. How much are influenced by global health, activation of or deactivation of the nervous system, or the immune system, personality traits, the energy she has available, and how she can use their energy, gut conditions, and so on. All of them are at play. I'm talking about this case because it's really coherent with the theme of my speech today. We need an integrative approach. In fact, before revealing the causes of these different expressions, as we anticipated a little before, in each of these situations, she is living different heartbeat and overall heart rate variability. That is a well-defined stress indicator. Just a quick look. HRV, heart rate variability, is related to all our physiology and neuropsychological factors linked by the central nervous system, and is influenced by environmental factors, something not modifiable, and lifestyle. So we are able to change these parameters with just a short technique, but it's a very integrative technique. So EEG is an electroencephalogram. This is a global index of coherence. So she's disrupted in the first session. In the second, with the two different techniques, she's feeling better. And at the third level, with the third variant, she's at the top. Okay, we are guessing something in about the pictures. Perfect, very good. Okay, this is interesting because it's not easy to understand this because she's always doing in all the 6 pictures an exercise where she recall a negative event. And the variants are these. She's trying to do a push away exercise where she tried to push away. In this case, I respect our privacy, so I don't explain exactly in detail what we worked on. But in general, you can think to push away a bully at school, a theft, a kidnapper, also a sexual abuser. So you can think to push away any kind of person in different contexts, also your father or your mother when were yelling at you and you were a child. In version A, she has just the position, but she's giving no intention to this movement. And in fact, we have no differences regard to just a talk therapy, rethinking about that episode. In version number 2, she's pushing away with a forward movement. So she's pushing this way. And she's imagining to put away the problem. In the 3rd version, she's also pushing, but we work on another biomechanical detail. She's lightly rotating the hand this way, okay? Because our muscle insertion and our bones are made to rotate. Okay, I can try to expand a little bit. Okay, this is this bone. You see that it's not straight. It's has already a torsion in it. And also the muscle has this kind of insertion. And this is very important, not just to have more power. And of course, if you go to the game and use the appropriate meters, you will see you have more power, but this power has a great biofeedback to the brain, and so give you a better sense of energy, to be in control, of a sense of mastery of the situation. And in fact, we have an increase in all the parameters. And this is the biological evaluation. You can see in this isolated progression a more confident face. She's not totally relaxed, but of course she's thinking to push away an assaulter. So it's a good expression to be in that situation. And she and all the participants to this kind of research confirmed also a better feeling and a better sensation in that moment and in the following days. Here you can see a little hint. It's not easy to give this perspective from a frontal point of view, but a reminder of the movement of the hands. Okay. We can also do something more. The 3 faces on the lower row, she's doing the opposite movement. So the sequence is the same, still in this position, but this time she's pulling straight and pulling with a rotation. The reason is the same. And if you see, the increase is even better in this version. Why? This is biomechanics, we have more power throwing, pulling that throwing away. But here we have also an ethological explanation. You can have the real control of your enemy if you submit and control it. In fact, also in martial arts, you have the control if you block your enemy, not if you push it away. This is from this point of view. Everyone practices the sports who likes, but Thai box are about the knockout, because it's a demonstration of power. But Oriental martial arts are about submitting the other and remaining flexible. In fact, the slogan for many martial arts approach is the power of flexibility, not just the power. And so we have this kind of variants we can work on. This can be an exercise you do in your study, in your office. It is something you can recreate in real life with contextualized variants. For example, when you discuss with someone and you take and put your hand on his elbow, you can slightly rotate, not giving pain to him, but just giving the impression of the energy you are giving to him. So he will receive what he will receive, can be receptive or not to that signal, but the biofeedback to you, to have be in control, to do the right movement, it's very powerful at mental, emotional, and also neurobiological levels. One last point, then I can give space to some questions, if there are any, is that with this girl and other participants to this research, we work on this technique, of course, but we work also very often on other levels. And some of these levels, the more recurrent, so you can consider them with a lot of your patients, is that the microbiota gut social brain axis is very powerful. So the way you express your genetics, the so-called epigenetics, the social interaction, the environment, the abuse of some medication, some drugs, what you eat, the way you are born. So C-section doesn't allow kids to be covered by the microbiome of the mother, and this is a great limitation. Luckily, today in many hospitals they've started to do C-section where it's needed, but then take that germs and cover the baby very quickly, so to have this kind of protection. These kind of connections are on many levels, so neurotransmitters, GABA, norepinephrine, dopamine, serotonin, everything about stress, willingness, relaxation, are all influenced by the condition of our microbiome. And the message goes directly to the brain, to the stress axis. Both ways, you see the arrows is in both ways, the immune cells. So if we have someone with a tendency to allergies, to intolerances, we have to think about how to reduce the stress, but how to give more power, release tension in the body, as we have seen before, but also to give some rest and more physiology to the microbiome. In very hard cases, we need the support of a doctor. But in many cases, we can start to promote healthy lifestyles. The best, the worst enemy of the microbiome are sugars, carbohydrates in general. The leaky gut is a condition where these particles are separated and everything is toxic, goes straight down here. And we have the same inflammation we have after a trauma. So it is important to work on this, and bone broth, aloe arborescens, vitamin D3 are all natural, because vitamin D3 can be, it's a natural supplement, are all natural way to support and bring it back to physiology. And have very important feedback to our global health. In fact, probably you know, there are very interesting studies about fecal transplants, where fecal transplant is the easy way, non-invasive, clearly is invasive, but it's not surgical, to change part of our microbiome. When you swap the microbiome of a very nurturing mother with the one of a mother that is not taking care of her offspring, for some days, you swap also the behaviors. So something that we consider totally socially and emotional is hugely influenced by the neurotransmitters promoted by our microbiome. So it is, there are a lot of research about that, about anger, about the way we metabolize food, about gaining too much weight, about aggressiveness. So it is a very, very important complement to our daily work. One last kind of intervention, very we use very often, especially in young people, is that the use of screens in general, computer displays, smartphones, tablet, television, all these displays are emitting blue light. You can notice it if you have one of these devices turned on by night with all the other light turned off. You see a light blue surrounding you and that display. It is normal, it's part of how they are constructed, but this is very unhealthy for our sight. It is so dangerous for our sight that if you have a smartphone or a PC that is quite recent, but I think 5-10 years old could be sufficient, you have somewhere in the preferences the possibility to take on this night mode, switch night mode, the safe eyes mode. There are different names, but the concept is the same. The important annotation is that this mode was imposed to the constructor by law. So there are a lot of medical research explaining how bad is this kind of light for our well-being. And of course, it's not a problem for the eyes themselves, but also for the pineal gland, the production of melatonin. Melatonin is about a regulation of a sleep cycle, but it's one of the main antagonists of cortisol, the hormone of stress. So it is important to reduce the use of these displays and turn on this kind of protection whenever possible. And if you ask to your anxious patients after a week of this modality, they are always happy and more relaxed. Of course, the problem is not solved, but the general well-being is a little bit increased. Okay, I think I can stop here. Thank you for your attention.
Thank you, Doctor.
So much.
Very important presentation as usual.
Very interesting topic and needed, well needed. Okay, so إذا حدا عنده أسئلة please يكتبها بالchat as usual. ما عم نفتح كتير ميكروفون لأنه بتضل الchat أسرع. Okay, so there is a question. Some practices stress on inhaling from the nose and exhaling from the mouth. Are there any scientific reasons for this?
Yes, it's a very complex topic because generally speaking, it's healthy and better to inhale by nose and exhale by mouth. But it depends on which effect we want to achieve. So, for example, if we want to train someone to stay in control during a stressful situation, maybe also physiological at work, arguing with the spouse, it's important to start with the nose inspiring, mouth expiring, and then go to everything by nose, because reducing the amount of oxygen, you train your brain to use the oxygen you have. And more, breathing with the nose, with a reduced introduction of oxygen. For example, if you just close a little bit, not totally one nostril, and you practice this when you are calm, your brain decides that you have not enough mitochondria in your cells and start producing more of them. So you can use very different variants. On the other hand, you can use mouth breathing. When you use it, it is important to make a silent, a soundless exhalation. We generally use this. But doing this, it's important if you are doing a mantra, something that keeps you focused, that you have to reverberate. But when I told about the vagal reset respiration, when they breathe out, I suggest to totally relax the vagal nerve, to exhale without a sound from the mouth and have these muscles totally relaxed. Because if you don't make a sound, you don't contract the vocal cords, these muscles, and also these muscles. So once again, you can take a look at these details. I've seen someone who was asking about vitamin D3, D as detail. D3, I write it in the chat. This is a very powerful anti-inflammatory, very useful both for physical inflammation and for mental inflammation.
Okay, so Lelita also asked, can you please explain more about the effect of sex differences?
Sex differences about the microbiome, probably. I think it was in this slide. Okay. Also, this is a huge topic, but we can highlight a couple of very important themes. One is that the microbiome of the mother and the microbiome we have in the first years of our lives can influence our sexual expression at different levels. So it could be about I'm clearly a man, but I have so many secondary hair, no hair on the chest, not totally well developed testicles. So the gut can influence how much I have a big breast. So it's about how much you express your gender details. It can influence this, but it's not the only element, also the sexual preferences. So it is a part, but I know this is a very delicate topic, so I can't explain all I know, and it is not everything because it's very complex. The important take is it can influence among many other things. It's not the only cause of sexual orientation.
Also, we have a question. Should we switch off our mobiles before sleeping, or just we keep it away from us?
Okay, the better recommendation is switch off and away because the small signals, there is Earl Miller from MIT that is doing recently huge jobs demonstrating in a very scientific way the waves, the external waves that influence our brain waves, and cellular Wi-Fi, mobile networks are these kind of waves. So
screen, all the screens.
All the screens and all the networks signals. So we have to reduce them as much as possible. Of course, by contrast, it is not a problem if we haven't done yet, because they take a long time to give us problem. But why not introduce some more time without them? It's good also for the silence network, this one. This silence network is activated by any potentially ambiguous signal. So even a good WhatsApp message from our best friend saying, "Hi, do you want?" is ambiguous because we don't know what is proposing to us. So sometimes switching off also the notification is very good for our mental health.
I agree, of course. Okay, so also we have a question. Can we know the dose of the vitamin D3 that should be taken?
Okay, take it as a general parameter. I can send you some articles for those who want to go deeper, because it's not there is the so-called not one size fit all, but consider these extremes. Generally, for bones problem, they give you 10,000 units a month. From this point of view, for our neural inflammation, you need at least 10,000 daily. So, and it's not a medical dosage, it's a well-being dosage, but it's a field of research not so well known from many doctors. So yeah, the other parameters you can consider is that Dr. Coimbra is a specialist in vitamin D therapy, has demonstrated that less than 40,000 units at day are not risky, at least for a period that is less than 6 months long. So you can move in that range. Look at some literature about you. Another important thing, if you want to explore and do it yourself, some test, if you are, or your patients are more than 30 years old, always take, I write in chat, K2 vitamins. K2 vitamins, consider this: D3 takes the calcium in excess from our cells and release it. K2 take this calcium and put it in the right place. So we have stronger bones, but we have not problems in the liver, in the digestion. And it's important when you are more than 30 years old. Before you are so young that your body can do everything by itself. After that, you have to help them.
Okay.
Oh, I see microbial health. Parasitic cleanse depends how you do it. I prefer to use the probiotics integration, and there are some probiotics. I don't know in Lebanon or other country. I can talk about Italy, France, and the UK. They are divided by kind of probiotics. So the general probiotics do very less interesting effects. Huge effects are available with selected. So also for this, I think it's better I send you some articles so you can look at them.
Okay, so still we have questions, but we don't
I think we have to respect the time of the other speaker.
Yes, because of the shortage of the time. But we need to make another session with you about this topic.
Maybe a training.
Yes, maybe a training together.
Whenever you want, it will be a pleasure.
Perfect. We need to talk more about this, especially in these times. So
thank you so much, Mr. Fabio.
Thank you for being
with us. Very important.
It's always a pleasure. Thank you so much.
For me too. Bye bye. Good
Bye bye.